All right, thank you for staying with us. Today is World AIDS Day, and the United Nations has estimated that based on current trends, the world may not meet the agreed global targets to eradicate the virus. In 2021, the UN disclosed that 650,000 people were lost to AIDS, while 1.5 million people newly acquired HIV. It blamed growing inequalities as a major factor obstructing the efforts to end AIDS. A statement by the Executive Director of UNAIDS and Under-Secretary General of the United Nations, Winnie Byanyima, stated that dangerous inequalities shows that urgent action to tackle inequalities can get the AIDS response on track. Earlier this year, UNAIDS said AIDS response is in danger with rising new infections and continuing deaths in many parts of the world. The report shows how gender inequalities and harmful gender norms are holding back the end of the AIDS pandemic, while stressing the need to address the intersecting inequalities women were facing. Mrs. Byanyima regretted that in areas of high HIV burden, women subjected to intimate partner violence face up to a 50% higher chance of acquiring HIV. Joining us on the Midday News to discuss the commemoration is Program Manager, Hazy Health Initiative, Choma Osakwe. Thank you for joining us on the news.
Thank you.
Now, when we talk about equalize or addressing the inequalities and bridging the gaps, what are we really speaking to, if you could break that down for us?
Okay, so when we speak about equalize, we're basically, trying to call to action and advocate for, dismantling of inequalities that result in HIV/AIDS. We know that there are a few of those challenges. We have gender and cultural norms. We have discrimination and stigmatization. So we record that people would not necessarily go to hospitals or receive care because of the fear of stigmatization. You go to your regular stores or the pharmacy to access condoms or contraceptive, and you have the healthcare workers there looking at you funny. Because of things like this, people are not necessarily going to go there to access care. We have pregnant women that won't go to the health facilities or register for antenatal because they are scared of getting tested for HIV, and then fear that they would receive a certain sort of response from the healthcare workers. So issues like this are sort of the things that still draw us back. Now, if people are not going to get tested, if people are not taking their treatment, if people are not, being watching or managing the situation, they go on to infect other people. And the numbers keep rising. Aside from discrimination and stigmatization, we're also looking at gender inequalities. We know that women are more likely or more at risk of, being infected with HIV. We're looking to increase access to education. We know that when women, or studies have shown that when girls are able to stay in school, the risk is reduced by 50%. And even with that 50%, when they have access to comprehensive sexuality education, that number goes down further. So we're looking to keep girls in school, educate them, increase awareness, reduce gender-based violence, all of that. The power dynamics between men and women plays another huge role. In some situations, women are not able to access care except they take permission from their husbands or male counterparts. So some of those things are things that still draw us back or hinder us.
But one would expect that with the kind of awareness campaign we have had over the years, and with the level of the investments perhaps government has made with addressing HIV and AIDS, that would have moved past these inequalities. So what is it that we are not getting right? It means there's something still underlying that we are not seeing and addressing.
So a lot has gone in to addressing HIV over the years. Is the financial resources and human capital. A lot of things have gone up, but we sort of kind of still record some of these drawbacks. We know that cultural and traditional norms are things that are, they're not easily being fought. They take time to sort of implement. So when we're talking of, going down to communities, because we can sit down here, and say, oh, we're creating awareness, but are we targeting the people we're also targeting?
Right.
Are we going down to the community levels to spread this knowledge or spread this message? Are we targeting the right kind of people? All of those things are things we need to bring back in focus, look at and address.
So you earlier spoke about stigmatization and perhaps also looking at inclusion into the population. How do we destigmatize? How do we include these persons back into the society such that they feel safe?
So it boils down to creating awareness. A lot of people still don't understand, HIV. There's still a lot of myths and misconceptions out there that if you come close to someone, you get, so all of those things. So what we can keep doing is, creating awareness, taking this message down to the roots.
Awareness is never enough.
Awareness is never enough. We keep spreading the message, taking this awareness everywhere and beyond, seeking for policies that sort of protect the rights. So we have the Anti-Discriminating Policy Act. Signed by, Goodwill Jonathan. But what's happening with that? There's that, but a lot of states have not implemented it. So those are some of the things that we can do. Keep creating awareness, increasing access to treatments and care services for these people.
Now, new HIV infections among adolescent girls and young women are declining, according to a UNAIDS report, than among males of same age in sub-Saharan Africa. I'm wondering why.
Okay, so so the thing is, with men, and the patriarchy and all of the things that come with being men. So we see that, we find out, and it's not even in HIV, we see that women are more likely to assess care, or go and get help or get care. Men are more egocentric. That's the word. Thank you.
I said it.
Yes, you said it. So men are more like that. They would rather, I can handle it.
There's nothing wrong with me.
Yeah, there's nothing wrong with me. Failing to accept what the realities are. So that's one of the reasons why, men, the incidence rate in men is, still going up. That's.
So for a day like this, quickly now, how do we commemorate it?
Okay, so a day like this, we're calling to action, equalize. We're putting the message out there, getting all key stakeholders involved to lend their voices. We're calling on making smarter investments, human, financial investments. It's never enough. I know we say a lot of funding has gone into eradicating HIV and AIDS, but it's never enough. Look at our statistics, right? So we need to, put forces together, collaborate. Collaboration is a very big part of it. We can't work in isolation.
Absolutely.
We have to come together, pull our forces together, and keep creating awareness and targeting the right kind of people, and also increasing access to treatment and services. Because it's one thing to get people tested; it's another thing to be able to provide treatment and care. So that's what we should be doing.
We'll have to leave the conversation here now, and we hope that if all of these measures that are taken, we'll be able to bridge the gap and perhaps meet the target proposed by the World Health Organization.
Definitely.
We'll have to leave the whole conversation here again. Choma Osakwe, Program Manager, Hazy Health Initiative, thank you for your time.
Thank you very
on
much.
The news.
Thank you.